Hi guys, my name is Abhay Patan and today I am going to discuss the ischemic heart disease. So let us begin. So guys, in order to understand this disease, we need to first understand what is ischemia. So ischemia is basically whenever an organ in our body is lack of blood. Okay, so it receives small amount of blood. So that way it undergoes ischemia. Okay, so now coming to the ischemic heart disease. So it is also known as coronary artery disease (CAD) or coronary heart disease (CHD). Okay, it is a medical condition characterized by reduced blood supply, blood flow of to the heart muscle due to atherosclerosis. Okay, now uh, let me tell you what is atherosclerosis. So, atherosclerosis is a condition in which there is a buildup of plaque in our blood vessel. So that's why as you can see in this diagram, this is the normal heart, normal blood vessel. Okay, healthy blood vessel, and you can see the buildup of plaque in this vessel. Okay, so you can infer that the blood flow to the to the heart is going to be less. So that's why the heart will undergo ischemia. Okay. Now coming to the ischemic heart disease. So we have got three examples of the ischemic heart disease. Angina pectoris. Angina pectoris is a symptom of underlying heart disease, typically IHD or CAD. Okay. Now, patient describes this as a severe crushing pain in the chest, um, discomfort that occurs when the heart muscle doesn't receive enough oxygen-rich blood. Okay, as we have discussed in the previous slide, the heart isn't getting the right amount of blood due to the atherosclerosis. Okay, now, angina is often described as a squeezing pressure like or tight sensation in chest. Okay, now the patient comes to the clinic with the help of the hand. Okay, like he describes the pain as like doctor, I am having pain in my chest. He will make the fist and he will rub it against his chest. So you can infer that the patient is undergoing angina pectoris. Okay. Angina has three types: stable angina, unstable angina, and the principal angina. Okay, so now coming to the stable angina, this is the most common. It occurs when a person is undergoing a stress, emotional stress, or workload, like walking or running or doing some physical activity. Okay, so this undergoes and it doesn't usually worsen over time. Okay, pain. Okay. Now, due to atherosclerosis of coronary artery with 70% stenosis. Now, what is stenosis? So, stenosis is basically the part of the blood vessel that is like covered by the plaque. Okay, covered by the plaque. It is called the stenosis. Okay, so 70%, 70% of the blood vessel is covered by the plaque. So only 30% of the blood is going towards the heart. Okay, so so it will undergo ischemic heart disease. Okay, now due to atherosclerosis of coronary artery. Okay, now it also represents reversible injury to myocytes. Okay, now what do we mean by the reversible? Okay, so whenever like the stress is removed from the cells, it will undergo again normal function, so that it's called a reversible injury. Okay, and irreversible injury is again carried into the necrosis or apoptosis. Okay, now patient present with chest pain, diaphragm means sweating and shortness of breath. Okay, now you may ask why shortness of breath. Okay, so because the blood is not getting to the heart, so that's why what happened that the contractility of the heart decreases. Okay, so that's why the blood going to the lungs, it decreases, and therefore it causes the shortness of breath. Okay, and the pulmonary congestion. Okay, now patient yeah now coming to EKG changes. So there is ST segment depression. Okay, why? Because because ST segment depression is characterized by the subendocardial ischemia. Okay, subendo means endocardium slight above there is subendocardial space, so there we find the ischemia. Okay, actually the coronary arteries they follow the path like epicardium, then myocardium, and then the endocardium. Okay, so as epicardium is getting the blood supply. Okay, then the myocardium and then the endocardium. Okay, so wherever there is stenosis of the coronary artery, so first of all the region of the heart that will undergo necrosis is the endocardium. Okay, because it is the innermost layer. Okay, and the blood supply to the to that layer is from the epicardium. Okay, so first we will see the subendocardial ischemia. Okay, so I hope you get the stable angina. Now coming to the unstable angina. So this type is more unpredictable because this can occur anytime, like even when the person is at rest. Okay, and this is not yeah, and chest pain at rest. Yeah, rupture of atherosclerotic plaque and incomplete. Okay, this is very important. Incomplete occlusion of coronary artery. Incomplete. Okay, incomplete occlusion of the coronary artery. Okay, and the EKG changes ST segment depression because of the subendocardial ischemia. Okay, now Prinzmetal angina. So this type is caused by spasm of coronary arteries. Okay, um there is a variable contraction of the coronary arteries. So that is why the blood flow to the heart decreases, and therefore we get the angina. Okay. Now, yeah, and uh, temporary decrease in blood flow. Yeah, it often does occur at rest and can be relieved by the medication that relays the arteries. Okay, like the nitroglycerin. What does the nitroglycerin do? It actually vasodilates the veins, primary vein, and then the arteries. Okay, so therefore the veins are dilated. So therefore the venous return to the heart will decrease. So that will decrease the preload of the heart, and therefore the heart needs to less contract, so in order to pump the blood efficiently to the body, so heart rate will decrease. Okay, so coronary artery spasms and EKG changes shows SC segment elevation. Why elevation? Because there is a transmural ischemia. Now, what do we mean by the transmural ischemia? Transmural ischemia is basically when the whole heart, or the endocardium, epicardium, and the myocardium, these three days they undergo infarction. Why? Because of coronary artery spasm. Okay, so whenever the spasm occurs, the blood flow to the heart, it immediately decreases. Okay, so from 100% to 0%. Okay, so whole heart will undergo ischemia. Okay, so that's why I I I wrote transmural ischemia. Okay, guys, myocardial ischemia. So what is myocardial ischemia? It is a condition where the heart muscle myocardium does not receive enough blood supply and therefore undergoes necrosis. Okay, um in my previous slide, I have discussed angina. So angina is basically the reversible type of cell injury, and in this case it is a irreversible type of cell injury. Okay, so what happens in this type is that the necrosis of the myocyte occur. Okay, wait, I'll show you. Yeah, so this is the necrosis of the myocyte. Okay, yeah, and this is due to rupture of a atherosclerotic plaque, complete obstruction of the coronary artery. Okay, in case of angina pectoris, we get the incomplete occlusion of the coronary artery. In this case, myocardial ischemia, we get the complete obstruction of the coronary artery. Okay, now other cause in the vasospasm. Vasospasm, as I discussed in my previous slide, the prince metal angina. In that case, we get the transmural necrosis or ischemia. Okay, embolism, like a piece of thrombus might have traveled from the veins, and it might get into the coronary artery, and can cause a myocardial infarction and vasculitis. Vasculitis means itis means inflammation. Okay, so itis means inflammation, and vascule means vessel. So inflammation of vessel, especially the arthritis, which we see in kids less than 5 years of age. Okay. Now, guys, what are the clinical features? The patient presents with severe crushing pain more than 20 minutes that radiates to left arm or jaw. Okay, diaphoresis means sweating, dyspnea means shortness of breath, and symptoms are not relieved by nitroglycerin. Nitroglycerin does not play an important role in this case. Okay. Now, diagnosis. So, diagnosis, the infarction usually limits itself to the left ventricle. Okay. Now, initial phase, we get subendocrine necrosis. As I have discussed in my previous slide. See, wait, I'll show you. This is the epicardium. This is the myocardium, and this is the endocardium. Okay. The coronary artery, it travels from the epicardium, then myocardium, and then the endocardium. Okay, so whenever we get this myocardial ischemia, so first of all there will be subendocardial, because the vessel, because the blood does not go to the subendocardium. Okay, so that's why we get the initial stage as a subendocardial necrosis. Okay, and then later we get the transmural necrosis. Why? Because the blood flow is not, there is a complete obstruction of the coronary artery. Okay, there is the complete obstruction of the coronary artery, so that's why the blood does not go to the whole heart. Okay, so that's why we get the transmural necrosis. Okay, now how do we check with the help of blood? So as you all know, that necrosis is followed by the cell burst, right? Cell burst, or the cell membrane burst. Okay, so cell membrane burst. So the enzymes that are inside the cell, they will also leak out, and the remarkable enzyme which is used for the diagnosis of the myocardial ischemia is the troponin I. Okay, and it rises to 2 to 4 hours after infarction and peaks at 24 hours, and it returns to normal by 7 to 10 days. Okay. Now, guys, this is very important. So, we have got the morphological changes in the myocardial infarction. Okay, so we have got three stages. Okay, don't look towards this slide. Just listen to me. Okay, so we have got three stages. First is the necrosis. Second is the inflammation, and uh, scarring. Okay, so first we have got the necrosis. Second is the inflammation, and third is the this scarring. Okay, so first, okay, so as you can see in them, this is the time from the infarction, less than 4 hours. um okay, so we will get the complication like the cardiogenic shock, massive infarction, congestive heart failure, and arrhythmia. Okay, the, these complications are very fatal, and this can lead to death of the individual. Okay, now, yeah. So then we have got the inflammation. Okay, so first we have got the coagulative necrosis. Okay, and and arrhythmia. Complication is the arrhythmia. Okay. Then from 1 to 3 days we have got the neutrophils. Now, as you all might know, that the hallmark of the inflammation is the neutrophils. Neutrophils, whenever they come, we call it as a inflammation, acute inflammation. Okay. So, and uh, complications include the fibrous pericarditis, uh, and presents as the chest pain with friction rub. Okay. Now, after the 3 days, we have got the macrophages. Okay, macrophages are the cells that are present in the chronic inflammation. Okay, so chronic inflammation, we have got macrophages. Okay, and the complications are the rupture of ventricle free wall. Okay, which causes a cardiac tamponade. Cardiac tamponade is basically the so see guys. So whenever the necrosis occurs, the the left ventricle, it becomes weak. Okay, and it becomes so weak that it can rupture. Okay, so we see the blood from the left ventricle, it passes it passes into the pericardial space. Okay, and it causes the cardiac tamponade, and this is very dangerous, as pain is very dangerous in this case. Okay, now yeah, so intraventricular septum defects leads to shunt. Okay, now the idea here is that the intramuscular septum might get weak, and it might burst off, and therefore the blood will enter the from the left ventricle to the right ventricle and causing the shunt. Okay, and yeah, and or papillary muscle dilatation. Okay, leads to mitral insufficiency. Okay, now after 7 days, we have got 1 to 3 weeks. There is the formation of the granulation tissue. Now, what do we mean by the granulation tissue? This is the tissue in which this is basically the formation of the connective tissue or the scar tissue. Okay. Now yeah, with a plump fibroblast, collagen, and blood vessels. Okay. As you all might know that the scar tissue also needs the blood supply to in order to remain live. Okay. Now yeah. So after months, we get the white scar. Okay, which is followed by the fibrosis, and in this stage, we can get the aneurysm or mural thrombus or Dressler syndrome. Okay, aneurysm means the ballooning of the artery. Okay, so arterial wall becomes weak, so it is prone to rupture. Okay, and mural thrombus means like thrombosis of the whole artery. Okay, so that was it for this video. Thank you guys. This video was very was very, thank you guys. Bye.